Good afternoon, everybody. Welcome to Wellness Wednesday. Today I'm going to be talking about carpal tunnel syndrome. Can everybody hear me and see me? Perfect. Got a few thumbs up. Perfect. Let me share my screen. Not really sure why it took so long to talk about this topic. It's kind of a major musculoskeletal issue, especially in the office workforce. My computer is taking its time to share its screen. Okay, everybody see my screen? Can I get another thumbs up? Perfect. Okay. All right, carpal tunnel syndrome. Let's jump into it. So carpal tunnel is it's a condition of the median nerve. I know we've done a few topics now on the median nerve, but it runs through the, more of the middle aspect of your wrist. Comes right through here. We have this big ligament that goes across. It's the carpal ligament, transverse carpal ligament. It holds a lot of the bones and whatnot together down here in the hand. We have 8 little tiny bones around this area that a lot of the muscles and whatnot connect to. This nerve runs down here, and like we discussed in other topics, it innervates and has sensory mechanisms to the thumb, pointer finger, middle finger, and then the middle half of the ring finger. Okay, so that's your median nerve distribution. This is typically the area of where you'll have numbness and pain or some tingly feelings. Okay, you can look at this angle here. So if we were to cut the hand right through here and then turn it sideways, look at it. So here's those carpal bones that I was talking about. That ligament runs across to hold the hand in that position, in the shape it's in. And then look at all of these tendons running through here. Okay, those are all the wrist flexors, the finger flexors, all of those run down through the hand and through this, what we call the carpal tunnel. Okay, and then look at that poor little median nerve. Not much room for it to kind of go through there, right? So if we have inflammation, if we have excessive muscle growth or tendon swelling or anything in this area, an injury to this ligament causing some inflammation, whatever it might be, we get some fluid in here, we get some decreased range of motion, it's going to squeeze down that median nerve, okay? And there might be times that we don't really feel any symptoms of it until it's, often too late, okay? That's where we'll feel the weakness or the tingly or something in our hands that just doesn't feel right, okay? So there's the anatomy behind carpal tunnel. So a couple things I want to touch on: risk factors, arthritis that can wear down some space and some fluidity of those wrist flexors and the bones in there, causing that inflammation. Females are 3 times more likely than males. Those with diabetes, certain medications, obesity, if you have excess body fat in that area and it's kind of pushing down again, closing down on that area, pushing down on that median nerve. Body fluid changes, a lot of times this will happen with pregnancy or menopause. With pregnancy, it typically resolves itself after the pregnancy is completed. Thyroid disorders, and then anything to do with fluid retention, such as kidney failure or lymphedema, again, can cause excessive fluid in that area, leading to compression of that median nerve. Okay. Workplace factors, things such as repetitive prolonged use of wrist flexors. So those who are, working on a keyboard, your computer mouse, if it's not ergonomically perfect for you, it could cause issues. Those who are using drills constantly throughout the day, anything that's causing your wrist to flex or your fingers to flex can lead to this. Ways we prevent it: we want to reduce the force. Okay, so relax your grip. We try not to use it as often. Try to take frequent short breaks, just to keep those muscles from being overused. Pay attention to your form. Make sure when you're sitting at the keyboard, your hands are in the best position. Use your quote unquote perfect posture, your ergonomics. Try to be in a better position for your wrist. Basically, just pay attention to it, right? Try to get an ergonomic mouse and keyboard, specifically for carpal tunnel, will kind of help alleviate some of these issues. And then keeping the hands warm. If you're in a cold environment, things tend to tighten up, and blood doesn't flow as easily. So if keeping your hands warm, you're going to increase blood flow, all that good stuff. Okay. Can't read this up here. I think might be blocking, otherwise maybe you can't see it. It says Pronator Syndrome, Pronator Syndrome. So I have seen and heard of many cases where, a patient will go to a doctor and saying, hey, I think I have carpal tunnel or whatever. And they're like, yep, you have carpal tunnel. But the issue isn't coming from the carpal tunnel. Okay. So this median nerve, remember, comes all the way back up the body. Okay. And it comes up and it stems from the neck area, comes down the bicep region, down through the forearm, and then into this tunnel into the hand. Okay. And there are a bunch of branches, bunch of spots that this nerve splits off. One thing that I've seen a few times is this pronator syndrome. Okay, so this pronator muscle that goes across. Okay, it's a muscle that allows you to turn your hand over. So if your palm was up and then you turn your hand over to palm down, that is pronation. This muscle is responsible primarily for that. This nerve, the median nerve, can get entrapped in that muscle. It's actually more common than we would like. Okay. This anterior interosseous nerve is a little branch that comes off the median nerve right here. And you can see it comes all the way down and it innervates different muscles in different sensory areas of the hand. Very important for this to be checked. If you feel like you have carpal tunnel syndrome, this needs to be checked to make sure that you don't have decreased sensation here. You have sensation in this aspect of your hand. Okay, so it's the palm side. It's that little fatty, soft portion of the base of your thumb. Okay, if you have sensation there, then likely the entrapment is down here and not up here. If you don't have sensation there, or if you have, it looks like your muscle here is smaller than on the other side, you're probably not getting innervation from this section of the nerve all the way down. So therefore your entrapment and your issue is up here. Okay. So I know it's a lot to kind of take in, but it's just one of those things that if you think you have carpal tunnel, make sure you get it thoroughly evaluated to make sure that your issues aren't coming from up here, because they'll present very, very similarly. And I have heard horror stories of people coming in and having surgery. So essentially the surgery for this is they'll come in and they'll cut this ligament in order to make room. So they'll take a little section of this ligament in order to make room for this nerve to be able to breathe and function properly. Okay. And then I've heard people not get better because that's not where the issue is coming from. The issue is coming from up here. Okay. So before you go have surgery and have 6 to 8 weeks of rehab and being in a splint and all that non-fun stuff, let somebody thoroughly evaluate you and check you to make sure that it's not coming from up here. Okay. Here are the stretches and exercises. A lot of this stuff is very similar to the last couple of weeks where we've talked about lateral, what do we talk about? The medial epicondylitis, where we have the golfer's elbow. A lot of these stretches are very similar, okay, because we want to stretch a lot of the same muscles, okay. So active range of motion, that's simply just kind of flexing your wrist, making a fist, and then extending your wrist, extending your fingers, okay. This one doesn't really show extending the fingers, but extend the wrist, extend the fingers, okay. And this one's just kind of waving side to side. Don't let your forearm move, just move your hand side to side, okay. Then you want to take your fingers, spread them out. Okay, so that's called abduction, where your fingers are going away from the middle. Okay, spread them out. Then here's our wrist stretches. Okay, palm out, fingers back, palm down, fingers back. Okay, we want to stretch all those muscles, make sure they're moving optimally and they're at the optimal length as well. Tendon glides. Okay, so let's go back to this picture here. So you can see these tendons run through these little sheaths, okay? And they go all the way down into the fingertips, depending on which muscle, okay? At each joint, there's another sheath, okay? If your tendons aren't moving through those sheaths very efficiently, they're going to tighten up and you're going to get issues working their way back down the tendons, making things worse and worse down here, again, causing tightness, potentially inflammation, et cetera, and then leading to carpal tunnel. Okay, so tendon glides, that's just extend your fingers, flex your fingers, extend your fingers, flex your fingers, okay? Nothing to do with the wrist, just all fingers, okay? And then, of course, we want to strengthen, okay? So we have, you know, get a racquetball, tennis ball, stress ball, anything like that, where you can grip and squeeze 20, 30 times, a couple times a day, okay? Then you have your wrist flexion and wrist extension exercises, okay? So you want to hold on to something. I like this being like a heavier, like a bigger ball, because that causes your hand to not close as much. It's kind of more open. As you do the wrist exercises, it's going to help those finger flexors a little bit, okay? And then just turn your palm over so it's facing down. Do the same movements up and down, okay? Again, just strengthening all of the muscles in there responsible for wrist flexion and wrist extension, okay? And that is it. It seems very simple, but it's actually a very complicated issue, especially since it's so easy for them to do a surgery, but then the recovery from the surgery is so long. So if you feel like this is something that you've had in the past or, you know, may feel susceptible to, try these exercises, see if any of your symptoms go away, have somebody check you out. Again, make sure it's not that Pronator Syndrome. We want to make sure that the nerve entrapment is coming down from the wrist and not up in the forearm. Forearm. Although if the entrapment's up in the forearm, it's a lot easier to treat. There's a lot less going on there. It's just one muscle that we want to massage and get that nerve moving more freely. But other than that, that's carpal tunnel. Any questions, comments, donations? Cool. So little update. Thank you, appreciate that. Little update. This will be my last Wellness Wednesday. This is my last week at the city of Gainesville. I've accepted a full-time position over at a skilled nursing facility in town, where I will be acting as a full-time physical therapist over there. But as for Wellness Wednesday, the rest of the wellness team is going to try to continue it the best they can. We're going to shift it to twice a month, okay, so every other week. I believe it will be next week and then every other week after next week, if I understand correctly. Thank you, everyone. I do appreciate it. There may not be a sign-in sheet right now. I don't see Anna E here, but I will make sure you guys all get your points because I'll take a picture of the class, everybody who's here. Let me get a picture of that real quick. I will very much miss this place. It has been a tremendous 8 years. I have loved every minute of this job, meeting every single one of you. Running Pro Club for all these years, and just making the program what it is. It's been so much fun. I've loved this team here in Employee Health Services. We've just all grown to love each other a lot, and I will certainly miss it here, but I feel it's time to move on to a different type of population, people who I feel need my help just a little bit more than you guys. I want to go take care of them, try to help them, you know, get to a better place. So I appreciate you guys. I'll be around for another week. If you guys want to stop in, say goodbye, because I know I've built some pretty good relationships with a lot of you. I would appreciate that, although I hate goodbyes. But yes, I'll still be in Gainesville. So I will be at Parkland's Care Center. Okay, if there's no other questions, I'll hang out for a couple more minutes and then close the call. Thank you, everyone. Appreciate it.